Hello. Welcome to SalivaCast. I am Deborah Heller, and here I bring you evidence-based information about saliva so that you can have a more efficient diagnosis in your daily clinical practice so that you can take better care of your patients. I am so happy. This is our second episode. So let me introduce myself. If this is the first time you're joining us at SalivaCast, I'm a dentist, I'm a scientist, and I'm a university professor based in São Paulo, Brazil. And my mission is to bring evidence based salivary diagnostics to all dentists all over the world. Because by using this innovation, you'll be able to make more precise diagnostics of your patients to provide better care to them and ultimately to improve the health of your patients. I invite you today connecting at our Saliva Cast, our podcast about saliva, to join us in this mission to bring cutting edge saliva based diagnostics into everyday dental practice. And the topic we'll talk about today is actually about management, how to manage hyposalivation in your daily clinical practice. So it can be that the patient comes with a complaint of dry mouth or not, and then you do all the diagnosis tasks that we'll be talking also about them here at SalivaCast. But today I want to focus on management. I want to focus with you today on treatment planning to alleviate dry mouth symptoms. And I want to start with this individualization, tailored. The treatment planning to alleviate dry mouth symptoms should be tailored to the individual patient. This is key to your clinical success, to tailor the treatment for dry mouth to your patients. Today we'll be discussing a few tools, a few evidence-based treatment approaches that you can choose which one is the best for your patients because this is evidence-based dentistry. So evidence-based dentistry is when we connect the best of scientific knowledge. So what is the best evidence we have? And we tailor to the individual particularities of our patients. Also, something that's very important for dry mouth management is to have a multidisciplinary model of care. So it's not going to be, in many cases, just us dentists providing treatment to these patients. Many times we'll send them for example, to an MT. We will refer the patients for a consultation with a doctor, many times with a medical doctor, many times with a rheumatologist, ophthalmologist. It depends on the cause, on the underlying cause of this dry mouth condition. So let's talk today about these key components of this multidisciplinary model of care of xerostomia and salivary gland hyperfunction. And please do keep in mind that this treatment, this management approach must be tailored to your individual patients. So it all starts with patients' education. Okay, so this patient-centered process where us dentists we must emphasize the importance, for instance, of daily oral hygiene, the importance for this patient to come to our dental office, regular dental visits. This is a patient, every patient needs to use a fluoride, every dentated patient needs to use fluoride toothpaste, and this patient, they may require use also of a topical fluoride. It is important that to counsel our patients about cessation of habits that may be causing them even dry mouth, for instance, tobacco use. We know by fact that smoking causes mouth dryness. So this is something we will want to discuss with our patients. Also, we want to refer our patients to the management of systemic conditions and also medication use in consultation with patients, physicians, oncologists, and other healthcare providers. This is very important because many times the patient will come to our clinic with dry mouth, or we will diagnose it because I'll be talking more and more about this about in saliva tests, but please know that it's very important that we assess the salivary function, the salivary status of every patient in our daily clinical practice. So it may be that our patient has dry mouth, and this is also associated to this underlying condition, for example, an autoimmune disease like Sjogren's syndrome, for instance. So it's not going to be sufficient if I only take care of the mouth. I also need to refer this patient to an MD, for instance, a rheumatologist, to manage their Sjogren's syndrome, for instance. Okay, so this is something that as dentists we must have keep in mind always. We do have preventive measures that we will have to take in these patients because a patient with dry mouth is at higher risk of having oral diseases such as cavities, such as gingival inflammation, such as halitosis, for instance. So we have to take already preventive measurements on these patients. And in order to stimulate the salivary function, we do have pharmacological treatment approaches that involve the use of sialagogues. These are stimulants of salivation. And for patients who cannot tolerate sialagogue, we do have palliative measurements to improve salivary output, such as simple as chewing a sugar-free gum, for example. So let's start here with patients' education. This is an everyday process in our dental practice. We need to inform our patients to give them accessible and detailed information about what are the potential causes of dry mouth that the patient is feeling right now, and also which could be the potential sequela, the consequences of an impaired salivary secretion. For instance, dental caries. Patients with dry mouth are at high risk of having dental caries. Patients with dry mouth are at a higher risk of having fungal infections such as candidiasis, and also mucosal lesions, gingival inflammation, and goes on. So preventive oral health care needs to strongly focus on this patient's oral hygiene. And you dentists, you will need now more than ever to tailor this oral hygiene routine. For instance, a patient with dry mouth requires a fluoride, a toothpaste with fluoride, but also in this toothpaste, it's gonna be better for this patient if this toothpaste doesn't have sodium sulfate. So STS, the detergent that is present in many toothpaste, but you will want to prescribe for your patient a toothpaste without this detergent, because a patient with dry mouth ends up having a more sensitive mucosa. So you want to avoid more abrasive toothpaste, and also to avoid toothpaste that have this detergent, which is SDS. You want to prescribe for your patient a toothpaste without SDS, without abrasives, and of course with fluoride. So that's gonna be the perfect combo to active oral health for patients with dry mouth. Depending on the country you're listening to me right now, you have different options. You have options from Curaden, from the Switzerland brand, from in Brazil, they're known as Curaprox, Enzical, for instance. Um, you have also options from Sensodyne and goes on. So there are brands that will offer this kind of toothpaste. And listen to me, dentists, we need to prescribe it, because it's not like just go to the pharmacy and choose whichever toothpaste you'd like. This is not just should absolutely not be done to any patient, okay? And particularly to the dry mouth patients, they need to have prescribed toothpaste. What does it mean prescribed? It's still to be over the counter. They don't need a prescription for it. Let me clarify. But when I say prescribed is I am going to tell them which toothpaste to use, because the oral hygiene of my patients, of all my patients, and specifically of my patients with dry mouth, they need to be tailored for them and they need to be specific for them. So yes, I will want to guide them which toothpaste, for instance, to choose. Okay, it is very important that these patients carry a very meticulous oral hygiene regimen. Okay, including, for instance, twice a daily toothbrushing, regular use of floss, and another interdental cleaner, and also the use, if may be required, the use of mouth rinse, but this is also very important that we tailor this. And always, if you do choose for mouth rinse to add to this oral hygiene regimen, you want it to be alcohol free, because alcohol also causes dryness of the mouth. Talking about managing systemic conditions and medication use, you will want to consult with the patient's primary care provider or specialist. In many cases, if you suspect that this hyposalivation is due to underlying systemic disease or medical conditions. There are several systemic diseases and medical conditions that are associated with dry mouth. The most common one is Sjogren's syndrome, as I mentioned, but you also want to look for other systemic conditions. And today, almost half of all medications used worldwide has dry mouth as a side effect. So yes, you also want to be attentive of this and communicate with your patients and clinicians. Also, many patients that are going through radiation of head and neck, it's a common side effect to have a dry mouth. There are specific particularities of the intensity of the radiation therapy that could also be modulated in order to, it's impossible to avoid, but to diminish this damage to the salivary glands. When we talk about preventive oral care, this is very important, dentists, that a patient with dry mouth often requires more frequent dental visits, okay? So Typically, it could be every 3 to 6 months. Okay. Uh, Tobacco use, like I mentioned, smoking causes dry mouth, so you want to work with your patient about assessing about stopping. Okay, smoking. Also, counsel them about the cessation, the importance of stopping these habits that's causing them to feel their mouth dry. These patients, they all may find temporary relief when they are hydrated. So hydration will be always the first step for any patient with dry mouth. So you want to ask them, are you hydrated? Like, do you drink enough water? How do I know this? We calculate based on their weight. Okay. So it's basically 35 ml of water per weight. So let's see, like a patient with, I can calculate it right now. Let's say Testing, can you hear me? Okay, awesome. Okay, so we're back. Very good. Okay, so I think the audio actually stopped when I calculated how much water I needed for uh, to drink per day. So the way you calculate it is 35 ml of water per kilogram. Okay. So I weigh 60 kilos. I need to drink 2.1 liters of water every day. So the keeping the patients hydrated, that's key also to a good salivary function. Okay. So hydration will be the first step. Second, chewing sugar-free gum. This can be very good too. So mastication, okay, stimulates saliva flow, okay. So this way you stimulate salivary gland to produce saliva. So chewing sugar-free gum can be also very helpful to manage our patients' dry mouth. Moreover, we do have other physical stimulants such as photobiomodulation, laser therapy, low intensity laser therapy. We also have uh, electrical stimulation, both extraoral and intraoral. You have in Europe and Israel, for instance, Salipan. We did publish recently a two scoping review talking about which is the best physical stimulation approach for dry mouth treatment. We investigated all the literature, so all the evidence about this treatment approaches, both in patients with systemic conditions associated with dry mouth and also in patients that underwent radiation of head and neck and then have dry mouth as a consequence. What we saw is that the body of evidence is not very strong, okay? So we do not have very strong evidence for this physical stimulation of dry mouth, but there are already reports that it could be beneficial to your patients. In an evidence-based dental practice, you want to gather the best protocol, evidence-based so far, to use a physical stimulation of dry mouth and to tailor it to your patient. And if you're listening to this podcast and you're a dental scientist like myself, we do need more clinical trials, okay? So let's work on the science, on the clinical science as well, to bring better care to our patients. We must talk about also about pharmacological therapy, okay? So medication that stimulate saliva function. For example, we call them salagogues. So we have pilocarpine, cevimeline. We have evidence showing they have good results to treat hyposalivation in patients with, for instance, Sjogren's syndrome and also post head and neck radiation therapy. You do need to adjust the dose of this medication. This is very important. They are well tolerated, but you need to adjust the right dose. And you want to do this consulting with the patient's physician. Okay. About artificial saliva. Okay. Before we end this podcast. Well, you do know I practice an evidence-based dentistry, right? So unfortunately, there's no evidence at the moment that any artificial saliva actually works. Okay, there's been systematic reviews published in Cochrane, and they show that there's no evidence that using artificial saliva works. It brings a relief to the patient, but it's a very short-lasting relief, very short. And many patients that still have residual saliva, they complain that actually it makes it worse to use artificial saliva. So again, you want to tailor to your patient. It depends which is the underlying cause of your patient hyposalivation. You may use this palliative treatment such as artificial saliva, but currently, personally, based on science, I only recommend this to very severe cases of dry mouth, okay? And when I cannot stimulate saliva function. When I can stimulate salivary gland, when I have residual functioning salivary gland, in most of the cases, I do not prescribe artificial saliva, okay? Because there's no evidence it works. And what we see from patients' report in the clinic is that actually either it doesn't work or sometimes makes it worse. So there will be cases where you prescribe artificial saliva, but absolutely for not all the cases, okay? So please do keep that in mind. So conclusions. Whenever we talk about dry mouth, it's very important the initial evaluation of patients with dry mouth to include this detailed history to early and efficiently detect and diagnose uh, underlying causes, include this comprehensive evaluation of our patients, include the validated saliva tests in your clinical practice. We'll be talking more about those in saliva tests. And regarding management, which was the focus of our saliva cast today. So a systematic approach to xerostomia management is essential. So it's going to be interdisciplinary care. You collaborate with physicians regarding systemic conditions and medication use. You do this comprehensive management of xerostomia and hyposalivation, emphasizing in your patient's education. It many times needs to include, must include lifestyle modifications such as smoking cessation or avoiding caffeine or alcohol drinks, for instance. It may include the use of pharmacological treatment, the use of other salivary stimulants. It may include the use of sugar-free chewing gum to relieve the dry mouth symptoms. The patient needs to keep hydrated, and there is already a few evidence of physical stimulation of dry mouth. This is very important, not only to manage and treat our patients' dry mouth, but also because this will improve our patients' quality of life. And this is key. Very good. I invite you to follow SalivaCast here on your podcast streamer. I invite you to join my YouTube channel, Deborah Heller on YouTube. I also have an Instagram account. The name is in Portuguese, the dental scientist, so a dentista cientista on Instagram. And I'm also present on Telegram, a dentista cientista on Telegram. And I do have a new Instagram account in English, Dr. Deborah Heller. Okay, so I look forward to your feedback. I will make sure that all the data, all the evidence that I mentioned in this podcast, it's going to be here available for you as well. And count on me. Join us in this mission to bring saliva diagnostics and saliva hypofunction management to our daily clinical practice. Together, we can bring a more comprehensive evaluation of our patients and more health for them all, and consequently have, of course, more successful dental practice all over the globe. For that, you can count on me. I hope you have a great day ahead, and I'll see you at our next SalivaCast. Thank you so much for listening.